Hi, I'm Dr. Nicole Rochester. I'm a pediatrician, a professional health advocate, health equity consultant, the founder of Your GPS Doc LLC, and the proud co-lead of the B.I.R.T.H Equity Maryland project. B.I.R.T.H Equity Maryland stands for Breaking Inequality, Reimagining Transformative Healthcare. And the purpose of this initiative is to improve health outcomes for Black women and birthing people throughout the state. So this is really exciting for myself, Dr. Michelle, and the entire team at the Maryland Patient Safety Center and the Maryland Hospital Association. We know that by improving outcomes for Black women, we improve outcomes for all women. In the state of Maryland, Black women are 3 to 4 times more likely to die from pregnancy and birth-related complications, and twice as likely to have a severe complication. We know that these disparities are multifactorial. They are rooted in structural racism. They also are impacted by provider bias. And lastly, we know that there is a tendency to not listen to Black women when they present for care. What we know in the state of Maryland is that there are a lot of really good initiatives already in place, and those are primarily targeting our labor and delivery units, our obstetrician gynecologists. And so what's unique about B.I.R.T.H Equity Maryland is that we are specifically targeting non-obstetric providers. Our pilot sites include emergency departments, outpatient medical centers, community health centers, and home visiting programs. And we're doing that in an attempt to make sure that we're reaching the other providers who see pregnant and postpartum women in other settings. So we kicked off the B.I.R.T.H Equity Project in May of this year, and it was kicked off with a series of webinars, one by myself focusing on dismantling structural racism and bias in healthcare, and one by my co-lead, Dr. Michelle, on clinical cultural competencies, where she explored the clinical aspects of severe maternal morbidity and helping those to recognize the causes and prevention and treatment. Since then, our 5 pilot sites have been on the move, implementing the toolkit, which has a series of resources meant for all types of providers, including our non-clinical support staff. There is a resource library where they can access the recordings of the webinars, they can listen to podcasts, they can read articles and find other important information to help them manage patients. There is also a clinical encounter tool, which we're really excited about. And this tool allows individuals to identify whether or not their patient is pregnant or has delivered a baby in the last 6 months, whether or not their patient is Black, and then it walks them through a series of symptoms that they can check off. And based on the symptoms that their patient has, they receive important real-time information about different things that they need to think about, the potential diagnoses, very early management stages, and ultimately the message is to contact your obstetrician gynecologist expert.